Welcome to Business Talk with Meghan McNulty, the podcast that takes you behind the scenes of business success and reveals the strategies, insights, and stories that drive these professionals to thrive in the ever-evolving world of business. Whether you're an established entrepreneur, a seasoned business owner, or simply fascinated by the world of commerce, this podcast is your front row seat to learn from the best. Each episode, Meghan will bring you engaging interviews with professionals from diverse industries who will share their triumphs, lessons learned, and the insights they've gained along the way.
Hi, Jillian. How are you?
I'm good. How are you?
Good. It's great to have you here. So I just want to introduce you. You are a nurse practitioner and you're also on the Medical Aesthetics Advocacy Council Advisory Board. And you are a nurse practitioner focused on dermatology, right? So how did you get into dermatology?
I got into dermatology working in the emergency room, actually. A patient who had brought his mother in came in, and I had just graduated nurse practitioner school at the time. And they asked me if I was interested in becoming a dermatology nurse practitioner back then. And I had originally said no. And then after working for a while in urgent care, I realized that I wanted to know more about the skin, and that same practice was hiring. And so I gave that person a call and they told me, come on in for an interview. And when you get hired in dermatology, it's kind of a working clinical interview. So you come in and they interview you, and then they actually have you follow and interact with their patients to see if you're a good fit for their practice. And it worked out well for me.
Okay, great. So can you walk us through what a typical day looks like for you?
Sure. So a typical day for me involves full body skin exams. It involves rashes. It involves skin cancer surgeries. It involves excisions of cysts and lipomas, and just overall skin care maintenance, health management, kind of helping people achieve the best skin that they want to have.
Okay, great. What's a common misconception about skin cancer?
A very common misconception is that people think that it can't kill you, which is actually false. People die from skin cancer every single day. So it's really important to get your skin exams.
Yeah, I can imagine. I always, I'm like, what the heck? But it is important because you don't realize if you have a mole or something, it could turn into cancer. Basically, what's your perspective on cosmetic care when you're dealing with some of these skin cancer removals? Is there anything, or, I know it depends on, a younger population versus an elderly population, but do you have any thoughts on this?
Well, there's a lot of things that factor into cosmetic skincare, and I think the most important thing to remember, just depending on where you are in your life, I take care of geriatric patients, so those are patients that are 65 plus. Less is more. And in my experience, people, they want cosmetics, right? They see all the cosmetic stuff happening online. They see it on Instagram, they see it on LinkedIn, they see it on TikTok. And what works for one person doesn't work for everybody, and not everyone's trained in every single aspect of cosmetic dermatology. And so, when you're wanting to provide, patients with these cosmetic services, you really want to know what their overall goal is, what they're trying to achieve. And then you really want to know what your limitations are as a practitioner, because you don't want to work in an area cosmetically that you're not familiar with, or that you don't have, exceptional training in.
Of course, yes. What have you seen, what do people inquire about some of these aesthetic procedures and dermatology field, or?
Yes, I mean, every day, even people that come in for just their basic skin cancer screening exam, they're always asking about cosmetic procedures. They ask me what they can do for their rhytides or their wrinkles. They ask me what they can do for their sagging skin or crepey skin. And, then it's never the answer, crepe erase is going to work for you. That's never the answer. But you want to make sure that you're well educated and knowledgeable on, products and treatment services, that are affordable and also more expensive, because you also want to take into consideration your patient's budget.
What's creepy skin or crepey skin?
Crepe erase. It's the one, whatever that actress was from Dr. Quinn, Medicine Woman's Pushing. All the elderly patients ask me about it. They see it on, they still shop online. What is it called? Our grandmother used to do it, where she'd buy stuff off the TV. I don't know.
QVC? QVC?
Yeah, QVC.
I don't know. Okay,
QVC.
understood. Interesting. Okay. So if people are more proactive, so let's go back to the skin. If they're more proactive about their potentially their skin health or skin cancer, what's the benefit to the patient overall? Is there an
The
impact
benefit,
aesthetically as well?
yeah, I mean, the benefit overall is less skin damage over time, less lesions when you're in later stages of life. Unfortunately, a lot of people think skin cancer is a myth. They're out there tanning, they're using the tanning beds, they're smoking, they're drinking all the time, they're using, different types of things on their skin. And sometimes, it's not the right thing, but doing all those things, it ages the skin a lot faster. And so I think, if people can get themselves more educated, especially women, there's a lot of skin changes that happen in perimenopause and menopause. It will better on prepare them for later on in life. And expectations, it's really important to manage expectations of how the skin is going to look. In your 20s and 30s, you may have beautiful skin, you don't have acne, you don't have all these skin lesions, and then later on, you have all these little precancers that are coming out, wart-like moles, multiple skin cancers. And it's really important to educate people early on so that they're prepared, can do what's best for them, wear their sunscreen, take niacinamide, and protect themselves the best they can from the sun.
Do you see any concerning trends out there?
There's a lot of concerning trends, when it comes to how cosmetics are being marketed and how skincare products are being marketed towards young girls. There's a lot of ingredients where, those are things that they don't need, at age 12. Maybe you don't need all the stuff that's being marketed to them. And so that's a little bit concerning. The other thing that's concerning too is kind of the push for people to continually put in different types of aesthetics treatments. I think the FDA just issued a warning for RF microneedling. And so,
Oh, really?
yeah, there's
What?
there's a lot of concerning things that are happening out there, and I think you see them more on TikTok. And uh, you just want to make sure that you're going somewhere where they're not just trying to sell you the most expensive package they have. You want to make sure you go in educated with questions in hand.
Yeah, I didn't know about the FDA warning on RF radio frequency microneedling. I guess they're saying the traditional microneedling is now better than the radio frequency one.
I think it all depends on, where you're going to get it done and how they were trained and, if they're experienced or not.
Yeah. Have you heard about the exosomes that everyone's using now?
Yes.
Any thoughts on that?
Well, I mean, I'm a big fan of some of the exosomes, but like I said, you basically your skincare should be what is your goal? What are you trying to achieve? I mean, you could go out there and you could, put on 25 different serums in the morning and, five different ones at night, but what are you trying to achieve? Are you using the right products?
Do you think there's any exciting trends happening?
I don't know.
Yeah, no, that's okay. What's your advice for patients on choosing a provider?
I think, it that also too is dependent on what you want to achieve. Dermatology is a broad field. There are, physicians that are experts in certain areas of skin cancer, physicians that are experts in certain areas of cosmetics, lasers, neuromodulators, and same thing goes for physicians, assistants, nurse practitioners, even estheticians. You just want to go to somebody that knows what they're doing, is experienced, and can give you all the answers you need up front where you're going to go in, they're going to talk with you about what you're going to do, but they're also going to talk to you about the risks of the procedure and what happens if you experience any of those risks or unwanted side effects. If they can't answer those questions, then it's probably not the right provider. You probably don't have somebody that's an expert in that field.
Yeah, that makes sense. What do you think? Okay, so where do you think the dermatology and medical aesthetics industry is headed?
Well, I think it's growing very quickly. And I think, consumers want it, right? Patients want it. They ask about it all the time because, it's always in their face. It's being marketed to them on everything, on their phone, on their social media, on television. And, people don't want to age. They don't want to look like they're getting older. They want to look young forever. And so I think there's a lot more to come as newer treatments, newer medications, newer procedures come out and evolve.
I heard that actors and actresses aren't doing procedures anymore because they want to get roles that reflect the actual age they are, since everyone now looks like they're 35 apparently. So it's kind of interesting
Mhm.
that they've
Yeah.
stopped doing treatments. They can get roles as like, 60-year-olds or 50, late 50s. So I don't know, I read about that. What
Interesting.
do you think, what's your advice for like new practitioners, like, nurse practitioners in the dermatology or medical aesthetics? What would you advise? What kind of advice would you give them?
The first thing I would tell them is find a mentor and make sure it's someone that's going to be able to actually mentor you. Because, like I said, the industry is constantly changing all the time. Guidelines, policies, they all change constantly. And so you have to keep yourself up to date. Attend conferences, attend workshops, don't ignore the drug reps when they come. They are a huge part of education in this industry, and they can provide you with educational services beyond what your employer can give you. If you're lucky enough to have your employer pay for continuing education, you should be taking advantage of that every single year. Spend the money, spend more than the money, read the textbooks, go to the classes, go to the trainings, do your own training, do your own online training, but find a mentor, know exactly what you want to do in this field, whether you want to specialize in cosmetics, you want to specialize in, the laser portion of the cosmetics, or you want to specialize in skincare, pick because you can't be an expert in all those things.
What, do you think like you're going to be focused on in the next few years?
So, my focus is mainly medical and surgical dermatology first, right? I mean, skin cancer affects everybody. It really truly does. Some of these procedures cause horrific scarring to get rid of the skin cancer. And so, that to me first, that's the bread and butter of dermatology. That's why we're here, prevent someone from dying of skin cancer, right? Next, after that, cosmetics. People want to feel good. They want to look good. And, they want those cosmetic procedures because that makes them feel better about themselves, better about their skin. And so you have to be able to know something about that as well.
So if you want to prevent, if you have a history of skin cancer in your family, what should you do?
If you have a history of skin cancer in your family, you should start wearing sunscreen from the time you're exposed to the sun for the rest of your life. You should also take a supplement called HelioCare niacinamide. It's really good anti-aging. It also prevents free radical damage. So, from UVA, UVB rays, pollution, secondhand smoke, things like that. But you also want to make sure you're getting your skin cancer exams. If you've had any type of precancers, you really should be checked every 6 months because we know that once you have a precancer, you're going to get more of those precancers. And the goal of these skin cancer screening exams is to get it before it is skin cancer. If you've already had skin cancer, melanoma, basal cell carcinoma, squamous cell carcinoma, in the first 2 years for melanoma, we should see you every 3 months. Someone should be scanning your skin, checking your lymph nodes, making sure there's no recurrence or spread of that lesion. Basal cell carcinoma, squamous cell carcinoma, depending on how many you've had, I typically like to see those patients every 6 months. If it's someone that's had a lot of skin cancers and they're still relatively young. And when I say young, I mean most of my patient population is 65 plus. I think the oldest patient I have is over 100. Every 6 months is good, but there's patients that I see that have had probably 20 or 30 skin cancers when they were younger, who I like to screen a little bit more because they have a lot more actinic skin damage.
Interesting. So Jillian, I know you're on the Medical Aesthetic Advocacy Council and you're on the advisory board, and basically that group is focused on making sure they get ahead of regulations in the industry on nurse practitioners, estheticians, for, PAs and doctors, or people that own, medical spas or, medical practices. So do you think that advocacy is important, and what would you say about that?
I mean, I definitely think that advocacy is important because there's a lot of people out there doing cosmetic procedures that don't have the training. And so it's definitely something that's important. I think it'd be great to have more people on the medical side involved in things like this, more people on the aesthetic side involved in things like this. People really need to focus on prioritizing their training, their aesthetic procedures, make sure they have safety protocols and are able to educate their patients. And a group like this is great for things like that.
Like, how do you think practitioners can get involved in this stuff? I know you attend conferences and stuff. What would you say?
There's a lot of conferences, right? There's a lot of dermatology conferences, and I've probably been to almost all of them, and they're all equally fantastic and equally different, right? I think where this group could prioritize getting more members, more people involved would be at some of the aesthetic-based conferences. ODAC is a really good one, but also kind of advocating for experts in the field, right? So as this, group continues to expand, you want to look for an expert in laser, an expert in neuromodulators, an expert in dermatology, cosmetic surgery. I mean, those people exist and they speak at these conferences, and just, getting them involved in this and getting them on board, which I'm sure a lot of them are, especially when it comes to advocating for patients' safety and standards, right? We all want to do no harm. And so I think, if this group gets out there, lets people know, and can also, get advertising on some of the association boards for nurse practitioners, MDs, DOs, PAs, I think that this group has, a great future.
Yeah. So if anyone wants to find you, where can they find you at?
So right now I work for Evernorth Care Group, which is being acquired by another health group on December 31st. And then in January, I'll be working at Arizona Dermatology Specialists.
Amazing. Is there anything else you'd like to tell us?
No.
Okay, great. Well, this was fun and, very informative. I think people, don't realize all this different specialties out there, and also the different specialties in the medical aesthetic world as well. So dermatology is a big part of that.
Yes.
And your skin health. Yes. Wonderful. Well, thank you.
You're welcome.
If you've enjoyed today's episode, please consider subscribing to the Business Talk podcast and leaving us a review on your favorite podcast platform. Your feedback helps us grow and improve. Thank you for joining us today. This has been another episode of Business Talk with Meghan McNulty.